Surgeons/doctors of Reddit, what's the dumbest thing patients have lied about? 1. Patient says to me, I was outside gardening while naked and I slipped. That's how a massive potato ended up in my ass. Anybody want fries while he is waiting to get it removed? 2. How did you get that stab wound in your abdomen? I put a knife on the kitchen counter and forgot it was there. Then I walked into it. 3. Me, have you had anything to eat or drink today prior to your surgery? Patient no, with a half-eaten candy bar in front of them. Me, are you sure? Because if you have, you could vomit upon going to sleep and it could enter your lungs, causing you to die. Patient, then yes I have, I had half that candy bar. 4. This one guy repeatedly used to come in saying he hadn't shit in 7 days. This would usually necessitate a rectal examination with a finger. That's why he kept saying it. Patient used to come in every time the new doctors rotated in, who wouldn't be wise to his tricks. 5. One guy came in feigning unconsciousness. Did not respond to even the most painful of stimuli, some of these were pretty painful. Did not budge. We were talking amongst ourselves about intubating him. He then opened his eyes and said they did that last time, I didn't like it. Not considering the psychiatric and the boring answers, like people who just swear with all their heart that they are taking their medications when they clearly aren't, which is the vast majority, there's not much, really. Only one really unique comes to mind. It was a patient that was a really kind old man who always would talk a lot with us, telling stories, praising the beauty of everyone in a tender and respectable way, saying how really grateful for our work he was and so on. Said old man would always appear with really high blood pressure values, even though he would swear that he always used his medication correctly. And after we did so many changes with his medication in many different ways, it's only natural to think that there's some problem with how he's taking them, if he was doing it at all. However, one day, after noticing that he would always go to the bathroom before even reaching out to the receptionist, someone discovered he would always eat a load of pure salt before being seen by any of the doctors, trying to make his pressure intentionally go sky high. Later we also, obviously, discovered that he indeed would not take his medications correctly as well, in order to obtain this result again and again. Turns out he suffered a lot from loneliness, and he was an old man that didn't have much contact with his family anymore, but mostly because his family didn't reach out to him almost at any given time, even though everyone lived close by. And in his desperation, sustaining dangerous high blood pressure was the best way that he had to obtain human contact within the emergency every week. This was the most odd one, but it's really common in general among elderly patients to appear lying about their symptoms, only trying to gather some attention and a private minute to speak about anything else. Most of the time they book an appointment only to talk about recent trivialities, which makes them clearly better, although by the end of the talk, it's also easy to see how they gather back part of the sadness that the loneliness bring to them. Around my patients, at least, it's common for many to cry as they leave. Loneliness is a hell of both a simple and complex problem. And one that no one should be bound to live with. Nurse here. The absolute dumbest thing patients have said, and to be fair this was the patient's parents since I was in petty but still dumb AF and caused no end of grief trying to unspin it. I was rooming patients and I went to the full lobby and called the next one in by last name. They stand up and mom and dad bring the little girl back. I'm rooming them, take the vitals, review purpose of visit, make some adjustments to the chart, update their pharmacy and allergies and go out and let the pediatrician know they are ready. The pediatrician goes into the room and come out like 3 minutes later and says, "That's not my patient, where is my patient?" I'm like WTF? I go in and ask the parents and no in fact they were not the patient. I'm like why did you say you were someone you were not? They simply said they didn't want to wait so they just came back. We had to completely unspin all the changes to the chart and had to get legal involved to make sure there were no HIPAA violations, which fortunately, there weren't. I'm fascinated that people can collectively think, yeah, let's do this, no one will know. Like, how does that even play out in their minds? Resident doctor here. This happened during my psychiatry rotation in medical school. I wouldn't say it was a dumb lie since the patient was mentally ill, but I would say it was the most memorable lie. There was a patient at an inpatient psychiatric facility for suicidal ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously. So the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist, and her primary goal was the attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria.